Hello everyone, I am Dr. Prachi Kulkarni, Fertility Specialist, 49 Fertility Center. Today I am going to talk about some of the commonly asked questions which most of the times our patients ask us in the OPD or sometimes our viewers ask in the comment section of our videos. So if you also have any doubts or any queries, I would suggest you to put it in the comment section so that we can try and answer your queries in the next video. So coming to the first question for today, will IVF result in twin pregnancy? So when we consider IVF cycle, after embryos are being formed, we discuss with the patient based on the grade of the embryo, based on your chances of conceiving with those embryo, where we also consider your age factor, your condition of your uterus, your lining of the uterus. So considering all the factors, the doctor will suggest either to go for single embryo transfer or two embryo transfer. If at all you have a choice and you have already undergone a PGTA cycle where you have a euploid embryo, doctors always suggest to go for a single embryo transfer, which is a euploid embryo. So the chances would be maximum with single euploid embryo. Then it will not result in a twin pregnancy. Then it's more likely that you will conceive with a singleton pregnancy. But if you have been suggested, or for some reason like because of your previous failed IVF, if you have decided to undergo a double embryo transfer where we may transfer two embryos, in that case there is a chance that you may conceive with a twin pregnancy. So when we are transferring two embryos and it is resulting in a twin pregnancy, then we call it DCDA twins. So it is dichorionic diamniotic twins. So the risk associated with twin pregnancy will be there, but still the risk is less as compared to the monoamniotic pregnancies. So sometimes when we transfer a single embryo, after putting the embryo also, it may divide and result into a twin pregnancy. In that case, it is monochorionic twin pregnancy. So the risk associated with monochorionic pregnancy is slightly on the higher side. So if you wish to have a singleton pregnancy, which is actually safe for the mother and baby, then it is preferable that you undergo a single embryo transfer, preferably with a PGTA euploid embryo. So this is about the twin pregnancy. So second question is, what are the issues associated with twin pregnancy? So the issues associated with twin pregnancy at any age would be there is always a higher risk. We will consider it into risk which is associated to the mother and risk associated to the babies. So for the mother, there is a higher risk of getting gestational diabetes, that is the getting diabetes in pregnancy. Also higher risk of developing blood pressure in pregnancy, which we call it as PIH or preeclampsia in pregnancy. Also there is a higher risk associated of miscarriages in twin pregnancy. Also risk of preterm deliveries in twin pregnancy. Now coming to the baby, if the twin babies, what risk they will have? So the risk associated for the babies will be there can be an intrauterine growth restriction, IUGR, wherein the babies don't grow as required. Their weight, birth weight, may be on the lower side, so it's called as low birth weight babies. If the babies are born prematurely, then there will be issues associated with prematurity. So some babies may require an ICU admission. Sometimes they may also require a ventilator to support the breathing, and they may take longer time to gain weight and to go home after discharge. So NICU admissions basically. So these are the issues associated with twin pregnancy for the mother and the baby. So even when we suggest our patients, we suggest to go for single embryo transfer to avoid these issues. So single pregnancy would be safe for the mother as well as baby. So now coming to the question where twin pregnancy babies, will they grow normally? So twin pregnancies actually, if you don't have any other associated medical conditions, you are young, then the growth wise there should not be a problem. If at all you develop blood pressure or diabetes in pregnancy, because the twin mothers, they are more likely to develop diabetes and blood pressure in pregnancy, so then the baby's growth can be affected. So please consult your doctor at regular intervals if you are having twin pregnancy. Please follow their advice properly. If you develop blood pressure, or if you develop swelling in the feet, or if you develop breathlessness, or any symptoms which are not normal in pregnancy, please consult your doctor immediately and take treatment in time, so that if your sugar and blood pressure, if they are controlled, then to some extent we may prevent the effects of growth restrictions on the baby to some extent. Also, in that situation, your doctor may suggest to have an early delivery, or they may plan your cesarean section before date. So please consult your doctor, and whatever is best suitable for you in that condition would be suggested by the doctor. So growth wise, if you are healthy, if you don't have any other medical conditions, there should not be any problem. But twin babies do tend to have a lower birth weight, and they may have a little early delivery, so we call it prematurity. So these are the issues with the twin pregnancy. Now coming to the next question, how many days IVF injections are given? And I have heard at least 2 to 3 times you have to do IVF. Is it true? So how many days IVF injections are given? So basically what we do in IVF cycle is we give ovulation induction, means medicines or injections to develop your eggs. So these injections usually start from second day of your periods. So on second day we do a pelvic ultrasonography, where we see if there is any cyst or any other problem which we need to look for hormones of like your estrogen and progesterone levels. If there is no cyst and if your hormones are okay, then we start giving you injections which are gonadotropin injections from second day onwards. And what we do is we do a scan after 5 days to see how your ovaries have responded to that dose. So after 5 injections, if we are doing a scan, if the growth is fine, the same dose can be continued, along with sometimes we add the time injection, which is an antagonist injection to prevent premature LH surge or premature ovulation. Now there are 3 injections which we continue after 5th day. So these injections will be given for approximately 10 to 12 days. There might be some dose modification based on your scan findings. So everybody's response to the injections can be different. So that is the reason why we keep doing scans in between to see how your body is responding, and we make changes accordingly. So average is 10 to 12 days. Somebody may require 9 days injection. Somebody might even require longer stimulation like 14-15 days also. So these injections are given daily because their effect will not be lasting more than 24 hours. And to grow the number of eggs, we need to support with the hormones. So these injections are very important. So please take your injections on time and listen to your doctor's advice during the stimulation cycle. So this is about the injection dosage. Now the second question is, I have heard at least 2 to 3 times you have to do IVF. Is it true? So it's not a necessary condition that you have to do an IVF 2 to 3 times. It depends what is your age, how many eggs we retrieve, how many embryos we get in IVF cycle, what is your egg and sperm quality. So what is your embryo quality basically. So if your embryo quality is good, your uterus is in good condition, your lining of the uterus, that is endometrium, is growing well, between 8 to 12 mm, and you undergo a transfer with good grade blastocyst stage embryo, then the chances would be somewhere around 50% to 60%. So this is the chance in the first IVF cycle. So if at all unfortunately you don't conceive in the first cycle, and if we have excess number of good grade embryos which you have frozen in the first cycle, then second time what we do is we evaluate the results of the first cycle. We see if anything which can be improved in the second cycle regarding your endometrial preparation, regarding giving support in the form of hormones or any other procedure which may be required like hysteroscopy, and then we can plan your second embryo transfer directly if you have good grade excess blastocyst stage embryo frozen from the first cycle. if by chance you don't have any frozen embryos of the previous cycle, then you may have to undergo a second IVF cycle to get fresh embryos for the transfer. So the success rate would be with a good grade blastocyst stage embryo in a good uterine lining would be somewhere around 50 to 60%. It may vary depending upon the correctable and non-correctable factors. So success rate, if it is 50 to 60%, most of the times within 2 transfers you should conceive. So that is about the number of times the IVF needs to be done. So there is no limit as such, but if you have good egg reserve and if anything can be corrected, you can undergo more IVF cycles also. So please consult your doctor regarding the same. So this is about today's questions. Thank you everyone for listening. So if you have any queries, please put it into the comment section so we can answer your queries and help you in your fertility journey. Thank you so much.